urination is there. And he got click because he was knowing diabetes means frequent urination. That the people we are knowing since 1500 BC. So he said, okay. Then I understood. Otherwise they would not have even thought about it. Because pancreas is removed. Pancreas do two functions basically, diabetes and the digestion. Two functions, right? When entire pancreas is removed, naturally the digestion will get affected, and he will write a paper, the digestion gets affected when the pancreas is removed. But that was not a major as far as the diabetic research is concerned. So to my mind, the diabetic relationship was possible because of that laboratory attendant. But we don't have laboratory attendant's name. So this always happens because Minwaske is a sir, he is a great person. And so ultimately, after this what happened? The insulin discovery. See, the insulin discovery took place in 1921. Now 1889 to 1921, the people have now thought, okay, what happens? The diabetic dogs are becoming diabetic, how to cure it? Is there anything? But Dr. Banting, he believed that destroyed rest of the pancreas, he could isolate the key substance. By destroying the digestive part of the pancreas, exocrine portion, it is possible. Why it was his vision be Banting? Because see, these are the digestive enzymes which are there in the exocrine secretion I have told you. These digestive secretions, when the pancreas is removed, and if the pancreas extract is made and given back to the dogs should come out of diabetic problems. But it was not that simple. People might have thought, already work on it, the scientists. But it was not that simple because the digestive juice, whatever the digestive enzymes, they were digesting the insulin. We are breaking the insulin. So insulin is no more insulin. Naturally, the diabetes will not be cured if entire pancreas is just crushed and injections are given back. So that he was knowing it. So he said that the problem is with this exocrine portion. If I destroy this exocrine portion, it is possible. So what he did, he tied the pancreatic duct and supply of nutrition to this exocrine portion was stopped maybe for 7 weeks or so. The entire report is there in the Nobel Prize .com. So there they have mentioned it. So around 7 weeks, he kept it tight and then removed it from the dog, the entire pancreas. And so by tightening the pancreatic duct, the exocrine cells died. So there will not be any pancreatic enzymes. So enzymes not damaging, and whatever portion is there that he injected, and he found that the diabetic dogs were almost symptomatically felt better. But what happens? The Dr. Banting, see, there was Dr. Banting and MacLeod. The MacLeod doctor was a chief of that laboratory, and he conducted the entire experiment. And MacLeod actually, Banting gave the idea. Dr. Banting came to the MacLeod, sir, I have got idea of diabetes. Probably with this we will be able to find some solution for diabetes. He said no, and then finally it was settled. Yes, okay. What do you want? I will give you 10 dogs and one person to assist. And that one person to assist was Dr. Bess. The Dr. Bess, the age of Dr. Bess was 22 years. The age of Dr. Banting was 10 years older, 32 years. And assistant was given. And then Dr. MacLeod said, it's summer vacation, I'm going to Scotland for summer vacation. He went for summer vacation, and then it is not mentioned what happened. But Dr. Banting worked on these 10 dogs, and out of 10 dogs, 7 dogs died in 2 weeks. So for research and other things, you know, if these 7 dogs had died, he is not getting any kind of results. He wanted results. That means he wanted more dogs. But dogs were allocated only 10 dogs. So funds were not there. So what he did? Dr. Banting sold his car to purchase additional dogs. He sold his car to purchase additional dogs. The Dr. Banting and Dr. Base removed the pancreas of dogs to induce diabetes. So once the pancreas is removed, the diabetes is there, that we know. That Minkowski's 1889 experiment. But then what? The dogs were injected the extract called islatin, and then later on it was named as insulin. And this extract controlled diabetes in experimental dogs. So the job is over. Control of the diabetes was possible. But then the question comes, we are not going to treat the dogs, but we have to treat the human beings. So what they did, the Dr. Banting, Dr. Base, same thing. The pancreas of dog, insulin injected to diabetic dog, showed falling glucose levels. So he mentioned the blood glucose levels. Now we know that in 1798 the people were knowing it how to test blood glucose. So we are quite advanced. We are in 1921 now. So in 1921 it was possible to do the blood test of those dogs. That was fine. But this is just the experiment. Now we want to apply it. The first insulin injection in the world, for people to ever receive insulin were Dr. Banting and Dr. Best. But nowhere the mention is of Dr. McLeod. Both of them took injection intramuscularly and exchange in between. Dr. Best gave an injection to Banting, Banting gave to Dr. Best. And they have found
they had diabetes?
They were not diabetes at all. But they had some kind of ethical mind that when I am giving something new to my patient, if patient dies, let me test on myself. So they were willing, even if with that injection, they are really great, because with that injection, it would have possible that both of them would not have survived. But it's a great challenge which they have accepted. Before giving it to the patients, they have tested it, and naturally the good question is where you ask is, they were diabetes or not. They were not diabetic, and that's why they felt hypoglycemic. Their blood sugar came down. So weakness and fatigue to some extent. Of course, they were doctors, they must have done it, eaten some kind of glucose or sugar, that relationship. But after that, on January 11th, 1922, a 14-year-old with a type 1 diabetes named Leonard. But before that, let me tell you that Dr. Bernard, why he was so much interested in doing diabetic research. During his childhood, he saw a child with 14-year-old died of diabetes. And that time, the children suffering from diabetes used to die in a few days, few weeks, because no medicine was available, and the children suffering from diabetes, as I told you in the beginning, is only because of insulin, totally absence of insulin in the pancreas. Pancreas is not making a drop of insulin, and that's why the children used to die. So that's exactly the same age the Leonard was on January 21st, 1922. 1921 it was discovered. There were some lot of experiments, purification, everything. And then Thomson received an experimental injection at the Toronto General Hospital that would change the history. At the time, type 1 diabetes was thought to be a death sentence. So the Thomson life was extended by an additional 13 years using insulin. So this is the great success of diabetic treatment because of Dr. Banting and Dr. Best. Insulin saved the life. Before insulin, the only treatment for type 1 diabetes was starvation. The treatment was just starvation. The children used to starve, and I have read in the same library in one of the book what they used to do. The children used to search when they were starved. Suppose if the birds they are eating the guas, then whatever through their fecal matter, whatever the seeds are there, that seeds they used to eat. It was such a sad story because they were starved. Starvation is the only treatment. And the 16 million lives of type 1 diabetes, where the insulin is totally absent, patients were saved from the year 1950 to 2008. From 1950 to 2008, the 16 million, that is 1 crore and 60 lakhs of patients were saved because of Dr. Banting and Dr. Bay's efforts. And then what happened? On October 26, 1923, the Nobel Prize was awarded in medicine to Dr. Banting and Dr. MacLeod. What is your opinion? Whom should have the Nobel Prize should have been up? Yes, yes, correct. Yeah, correct. No, Banting was not a head of the department. Bess was a. Who? MacLeod was a head of the. He was department. No, that was the answer. No? Dr. Banting shared his prize to Dr. Pace. He gave $15,000. But see what happened, maybe to my mind, I understand it must be a price of $60,000. Then $30,000 came to Dr. Banting and Dr. MacLeod $30,000. And then he shared the 50% of it. That is $15,000, and $15,000 during that time is a great amount. One can purchase bungalows, cars, everything. The sold car, now he must have taken a new car.
Nobel Prize, there's actually statement is that Nobel Prize should be given by them to Dr. Banting and
Yes.
That as long as actually since beginning with Dr. Banting
and Dr. Bay's work. But then Dr. MacLeod shared his prize to Dr. Colley. But actually, Dr. Colley has done a lot.